Hi, everyone. Thank you so much for joining today's program on alternative therapies that enhance balance. Today's program will discuss therapies that improve communication from the brain to the body to enhance balance. And we will also touch on home therapies, nutrition, and supplements for you to consider discussing with your doctor. My name is Lindsay Colbert, and I am the Executive Director of the Foundation for Peripheral Neuropathy. Thank you again for tuning in and relying on our organization to furnish you helpful educational information for your journey with peripheral neuropathy. Before we get into the program, just a few quick logistical matters to cover. I want to let everyone know that this program is being recorded and will be posted on our website for future viewing needs, along with the slide deck. And for those who are participating in the live session today, a live question and answer will be offered at the end of the program. I ask that you submit any questions that are on topic for today's presentation and not any personalized medical questions, which we will not be able to answer. You can submit those queries through the questions chat box within the platform. And now I'm pleased to introduce our guest speaker. Dr. LeeAnn Manoni is a chiropractic neurologist and functional medicine specialist. She attended chiropractic school at the National University of Health Sciences in Lombard, Illinois. She studied under a highly trained Carrick Institute professor and learned how to utilize functional medicine in order to help those suffering from complex neurological disorders. Through this education, she became more and more intrigued as to how she could integrate this into her future practice. Dr. LeeAnn has achieved the highest level of training in the field of functional neurology by obtaining her diplomate degree in chiropractic neurology through the American Chiropractic Neurology Board. Her current practice focuses on both pediatric and adult neurological and autoimmune conditions, including chronic pain. Her passion is helping people that have been on a long journey in their health. Dr. LeeAnn has a personal story of Lyme disease, as well as dystonia, which is a neurological movement disorder. She found hope and benefits within her healing journey through alternative medicine. And this personal history makes her care truly compassionate and provides a creative way for her to look at all things that may promote healing for patients. And now I'm excited to pass the virtual mic over to Dr. LeeAnn for her presentation. Thank you again, Dr. LeeAnn.
Well, it's a pleasure and honor to be with you today to discuss the topic of improving balance. I first wanted to give a little bit deeper depth about why I'll be explaining the functional medicine and the neurological combination in my journey with patient care, along with my healing journey of the dystonia, which is a movement disorder which affected my face and my neck, as well as the Lyme disease. There's multiple parts to our body that require facets, or I call them buckets of care, that need to be filled. And there's not one thing that typically supports someone that's magical. And when it comes to balance, there's both how we get information to the brain through nutrition, as well as communication from the brain, from our body, and from our brain to our body. And so that was hugely an integrative part of my healing journey through dystonia, as well as having an autoimmune condition with a chronic Lyme, to just see things differently and look underneath every rock and explore things. So I feel like it gives what I call the A-frame experience for patients. It holds you up, it keeps you stable, and it gives you a further movement forward on your climb to becoming better in your health. With that said, I'm going to move on to the functional medicine piece. So functional medicine, I describe to patients, is a journey of looking for things that are pre-disease things, of catching blood sugar that might not be stable, or catching oxygen delivery to the brain, which we check with a pulse ox, or checking for deficiencies in labs. it's important that we explore our blood work because it's unique to us, but it's also very important to the brain that we get all of our information as well as our body, because not only is our body impacted by, having something that's deficient or not enough of something, but it also is really important that we just fill those buckets. So I often do deep dive into the lab work, but I talk a lot about lifestyle changes. And I'm sure this is topics that you've heard, but our processed foods are very convenient for us. And a lot of us will find things that are even healthy options that are processed foods. I recommend limiting those because they will oftentimes spike blood sugar. Blood sugar dysregulation can cause inflammation in the body. Inflammation is really cornerstone to all of our disease processes, as well as how we feel better, our mood, our energy levels, our inflammation in our body can all be targeted through that process of just balancing blood sugar. The less processed, the less we have this cycle of up and down. Elimination of wheat is often recommended for my patients. I do a lot of advanced testing for wheat reactions, which is also referred to as gluten. Gluten can be really impactful for the brain. There's a lot of research that validates our gut, which has microscopic junctions that are supposed to be nice and tight and protect us, because a lot of our immunity comes from our gut. They can become open or a little broken. And I often look for those things, but gluten in the research is found to open the doors. And we don't want our doors open in our gut because that's what protects us from being a strong individual and not having inflammation. So why is that important to the brain? And we're going to link functional medicine back to the brain. We can also impact our brain in the area of our cerebellum. And our cerebellum is located at the base of our skull. And it's really important for the starting and the stopping of motion of our movement of our muscles. And so it's a really big deal. The cerebellum can be affected when we eat wheat, and that's called ataxia or an ataxic gait. I have tested patients and found that some people do react to that area of the brain. And so when they stop eating wheat, their balance can be impacted because it was directly affecting the area of the brain. The next thing I often discuss is how many vegetables we eat. So many times we don't prepare enough, we're not planned to eat a lot of vegetables, but they're really important in our body. And the reason why is they help detoxify our body. And detoxification is really important because we get inflammation. That keyword inflammation is really important because it can make our body work better or make our body work less proficient if we have more inflammation. So the more stinky vegetables we can cook, like broccoli, cauliflower, cabbage, anything that's stinky is going to help detoxify your body. Also, fresh spices and herbs are also very beneficial to add to your foods if you can cut them up, because they also will help detoxify your body. Consumption of low sugar foods are also important because of this roller coaster ride. We don't want to go up and down all the time with our blood sugar, as I discussed. A big part of the brain is fat. I know old talk was eat low fat. There's a lot of changes that we've found. We found in research that the volume of the size of the brain actually is bigger and better when we have more fat in our diet. How do we get healthy fats? We can include it like butter. Coconut oil is a rich source of fat. We can use avocados in our diet. We can also use avocado oil when we cook. We can use olive oil, but we don't want to cook at high temperatures with olive oil because it changes the integrity of the oil from a good oil to a not so good oil. So using that in dressings or in a low temperature saute is a much better option. Proteins are very important for the brain too. And the reason why I'm talking about the brain is it's the motor of the body. And so if we don't support our brain well, we do not get good communication or the best communication out to our body. So protein sources, we want to try and keep them clean. If we can get grass-fed and grass-finished meat, or no antibiotics or hormones added to meats, it's going to be a better source for you. Proteins add fuel for neurotransmitters, which are what signal everything to say, I'm in a good mood, this is how I react to things, I have good attention and focus. We need all of those things for our brain to be really healthy. We have to have good buckets that I was talking about to be filled well for functional medicine. So I think it's good to do a deep dive into saying, how are my stress levels? How am I breathing? So many times people breathe from the upper half of their body when we're actually supposed to belly breathe. And our brain is greatly impacted by that because we're not meant to breathe from our chest. We're meant to breathe from our belly. There's also studies that have been found that if we breathe from our nose, we will activate our nervous system, which is more of our restful nervous system, which is really important for our brain to live in. We don't want to live in a fight or flight state because they've also found that more pain is generated when we live there. So if we have any type of neuropathy with either diabetic, idiopathic, or other unexplained reasons why, what can happen is pain can actually facilitate, or increased stress can facilitate more pain. So we want to try and dampen that. So again, we want to look at all the buckets. Do we have good oxygen to the brain? Do we have good breath to the brain? Do we have good blood sugar to the brain? And is our blood pressure maybe regulated as well? That can also influence our balance. When we lay down, we may have a certain blood pressure. When we sit up, we might have a different blood pressure. And when we stand, we might have a different blood pressure, which can also influence balance. So it's important to look at all of those things that might be influencing our brain. I do recommend supplements in my practice. A lot of times they're based on labs that I run. So it's really important to have things that match up. We don't want to just try things on our own. It's good to have a physician that guides you through those recommendations with lab work. These are a few recommendations that I use in my practice. Gooseberry is one that controls blood sugar and is anti-inflammatory and detoxifying to the body, which I talked about the inflammation. Endocalyx is a product that helps with the capillaries. Blood flow is really important for our body to have really good blood flow because our extremities, which are our hands and our legs, need to have good information that comes to them. And with good blood flow, we get better information. Vinpocetine is a product that impacts the brain, which I said is a big deal, but it also impacts our inflammation in our body, which is also where we want to target for a supplement. Berberine is a supplement that helps blood sugar and helps with inflammation. We have short chain fatty acids, pardon me, which help build a better gut. There are short chain fatty acids that are called acetate, propionate, and butyrate. Those are the ones that have the most evidence on them right now. They help the junctions in the gut stay nice and tight. They also influence the diversity of the gut. So why is the gut such a big deal? Is it's 80% of our immunity. And our immune system helps protect us from autoimmune conditions, helps us keep us strong when we have viruses enter our body. But it also influences our brain, which is where all of our communication comes from to go to our body to influence our balance. And that's why I keep repeating that message. Probiotic and a prebiotic there's a whole bunch of different strains out there. I recommend to people that they change the strains that they take because our gut needs to diversify. There's a lot of research that talks about different disease processes linked to different gut biome. We're kind of at the beginning stages of how much that's actually going to influence our health, but we know it does influence our health. So taking it, as well as eating healthy foods, they have prebiotics in them that are going to influence the bacteria. The bacteria need to eat all of the foods that we eat to become bigger and better and diversified gut. Lab testing. So lab testing is done in the early stages when I look at someone's health, but we evaluate for deficiencies, as I talked about. We look at stool analysis to look at the diversity of the gut. So what kind of bacteria are there? Are there not enough bacteria? Is there an imbalance of bacteria, which is called dysbiosis? Is there something that's called leaky gut? And leaky gut are those junctions that are supposed to be nice and tight borders in your gut that should protect you. But if they become loose or our immune system can go against them, that's called leaky gut. And what I do is look for that in lab markers, which can be done through a couple different companies that are out there that are called Cyrex Labs and Vibrant America. They look at the junctions to say, are they tight and protecting or are they open and loose? If they're open and loose, the foods that we eat and digest can cross through those barriers. And when they get down to the barriers, they go through the barrier to the bloodstream and get tagged it. Our immune system basically gets on alert and says, oh my gosh, this food is not supposed to be there, and we get inflamed. And how that influences our body is we have a constant level of inflammation when our gut is not protecting us the way it should be, and we are being influenced by foods that we eat on a daily basis. So in someone's journey of having better health and better balance and a better brain, our gut and our brain are a super big deal. We also can look at the brain through inflammation or autoimmunity. So our brain is protected by a barrier too. It's called a blood-brain barrier. That barrier can sometimes be broken or open, and we can get autoimmunity in the brain, and that can affect the balance center or messages that come down to the brain. So there's another layer that we can look at to say, is there something impacting the communication, or is the brain being affected by other causes? So we're going to talk about the brain communication first. So we talked about we have to have good fuel and delivery to the brain. It's like having the right gasoline for a race car. And if we don't have the best fuel and delivery, we don't get the right messages. The brain sends messages like that old game of telephone where you tell a secret to someone and it goes down. You want the same message to happen by the end of the chain, by the end to get to your feet, by the end to get to your hands. We want all the messages to be the best communication. So we're going to explore those through the areas of the brain. We have our balance center, which I talked about, the cerebellum, which is right at the base of the skull. We have the parietal lobe, which is on the top, and that is our GPS of where we are. If we bump into something constantly on one side, we know that area of the brain probably doesn't have the best GPS. We have the temporal area, which is located on the side here, and that has to do with when we hear a noise, how do we react to it, and does that influence our balance? The inner ear, which is not listed on the diagram, which is deeper, a deeper structure, which tells us information about our head and our body, if we're forward or backwards or to the right or to the left. And then we have our vision, which comes from the occipital lobe, which is in the backside. And that tells us visually what we're seeing. So we have a lot of things that influence our brain, a lot of communication that needs to happen, and it needs to happen together. So we're going to talk about the visual piece first. Hopefully, you guys will have a new breath of energy around different things that you can do at home or explore with practitioners that are close by you to be able to influence your balance in a new way. So our vision is super important for our balance. We have to be able to look at an object and focus on an object first and foremost. If our focus is not clear, our body has to compensate around it. Our neck will often have little movements around a not clear object. We can test vision through fancy technology that's called right eye. It's a therapy, it's a computerized technology that can look at the eye movements to see if you're not focusing well. We can practice and work on focusing just because it's going to benefit you for your balance as well. You don't have to have fancy testing to do that. So there's a chart that I have here on the right-hand side that is showing, I have laser glasses. I'm not going to turn them on, but you can put them on, and they have a laser that comes directly out of them. What that helps is it gives your feedback to your brain how well you're doing. So there's a foam mat that I'm standing on, which makes a little difference in the balance challenge if you have something underneath you. If you're really challenged with your balance, you probably want to stick to the floor, but you can use laser glasses to enhance your vision capabilities of focusing. You can start off with focusing straight forward on the central dot. You can work your way up to looking at a higher dot and over to the left and over to the right. Oftentimes when I see people, they're challenged in different directions. It's not always when they're looking straight forward. Our balance can be off in different ways that we don't realize until we start to do some therapies and say, oh my gosh, it was to the right that I actually had the problem. So the second part to vision is pursuits. So when you read a book or you're reading on technology, we have to have good tracking. So if you look at your thumb and you move it over and you're watching that thumb, you have to keep that nice and clean and crisp in your vision. You again can work on that with laser therapy by following a line like that's a big black line across the screen there, yes, and that will help with giving information to your brain and making that crisper and clearer. Saccades is the last visual thing. That is quick eye movements. We do those when we're scanning where we are, when we're driving, and we also may do it when we're looking at technology because we have lots of things to look at the screen. So we're just quick eye movements. We may respond based on a noise, but that information needs to be mapped well in our brain. So using the laser glasses or the cheaper version of that, which I've listed at the end with no proprietary connection to these companies, there is a laser headset that also is a cheaper model that basically just comes over your head and it feeds the laser straight out. So the glasses, like I said, gives us better information to the brain of how well we're balancing and how well we're doing, which you're going to make more gains doing that. The other part, which we found in chiropractic neurology, is the more we layer therapies together, the more the brain gets it. So our brain, I describe, is like a toddler. We have to keep telling it the same information over and over again, but just like a little kid, they like new and creative things that they want to learn in a way that's not the same thing. So we don't want to do the same repetitious things because it gets old hat. It's not a big deal anymore to the brain. But if we make it new and exciting and add different layers to it of a foam mat or a different stability underneath your surface, your brain's going to be like, what is this? I have to be challenged a little bit. I like to play a metronome, which is found again in research to be impactful to the area of the cerebellum. I'm bringing back the balance center again, and that tells our brain how to stay stable. And so if we hear a click, click, click in the background, they've found that in studies that people that did physical therapy with a metronome in the background actually had faster results, not even moving to that click, click, click when they're doing their exercises, that they found their results were faster and more effective in their muscular gains because of the metronome playing. So it is a huge impact on the brain, and it also impacts the biggest part of our brain for balance. So, and our balance center talks to our visual center. So I would recommend downloading an app that's a metronome. They're free, and you can play it in the background while you practice your balance. All right, we can make our balance challenge a little differently. So we're going to talk about our maps in our brain. So we have maps in our brain that tell us information about our hands and our feet. Our feet are obviously very influential on our balance. Our feet sometimes aren't mapped out well. And so I use this a lot with stroke patients. of just giving new information about where our feet and our hands are. And so what the Recognize app does, which is something you can download, is it puts your hand in different positions, and you have to pick on the screen whether it's your left hand or your right hand. And it's harder than it seems, because the orientation might be flipped and it might be tricky. But what it does is it helps us know where our feet and our hands are better. And sometimes some of our symptoms can come from poor mapping in the brain. So I recommend that for patients to do that. It's a fun task as well as a challenge for us. The newer technology that I've learned about recently is called a halo. This is a new technique that I learned that's called gravity reset. This has provided the most impact that I have seen to balance in the quickest time period for patients. And what it uses is this head weight that you see on the picture there. And it gives, and there's different weights. There's like a half a pound, there's a pound. What it does is it gives your brain some information about where you are in space. We have an inner ear part, which is like this, which when we're standing or seated, we're going to get information about where we are rotationally. If we're turned to the left, turn to the right, based on our inner ear. There are also parts of that are influenced by gravity, which I have in the slide ahead, but I'll show you in a minute. But gravity, this head weight, really influences that gravitational part. So let's say someone always falls to the right-hand side, or we'll use the right-hand side as an example. We will often use this therapy with putting the head weight on and the laser glasses, because it gives the brain feedback, a lot of good feedback at the same time. We will laser on a target, which I'm showing in the picture there, and then we will do steps to the right slowly with a metronome. What that does is it gives information to the brain that we need more information to the right. We often fall or have more instability in our balance to the side that's weaker. This is a newer type of therapy application, the gravity reset, because our brain has to know where we are in gravity, and our right side might not get as much information as our left side has, and that can be changed just over time. We also have an informational part about up and down. I'm going up and down. That's a part of bi in the inner ear. So we also give information when we do the targeting to go up and down in a little squat while we're targeting that laser, to be able to work on the balance when we move up and down. We sit and stand all the time. We go from laying down to seated. We want our brain to be the best calibrated machine that we have to tell us the right information at all times. So again, those laser glasses are used a lot to help with that feedback to the brain, as well as a metronome and the halo set. You could wear the halo just to give you a little bit of feedback while you're doing balance therapy as well. So we're going to go on to balance. We did the visual system. This is the inner ear I was talking about. We had that forward sense, the backward sense, the right rotation, left rotation, and then we have these super powerful things that are called the otolithic organs, which is a gravity perception of the up and down, and then the left and right, which are very, very influential. A lot of times people don't have vertigo and don't have issues with their inner ear canal, but they do have imbalances left and right with gravity, or they do have the up and down. They don't feel stable when they're starting to move that way. This next device was introduced to me from some advanced training I did for orthopedic rehab, neurological rehab to the brain. It's one of the coolest things that I use in my practice to help give information and strength to the toes. Again, I like to use a metronome in the background when I do exercises, because it gives more information to that balance center at the same time I'm doing the exercises. So if we look over to the left side, we can see someone coming up and down with their toes. That strengthens what they call the intrinsic muscles that are in our feet. There are often exercises that are taught of like toe pickups, where you pick up a candy and drop it, or a towel pickup, or a short foot, which is like you're bringing your foot up and holding the arch. It often misses some of these strengthening aspects. The guy that designed this, he is an expert in human locomotion, which means movement of the body. And so I think he's a really good expert to refer to. So he designed this Toe Pro to work on those muscles to make them stronger. It feels like a kind of a dense foam, but what they found in the research is if we do exercises to the metronome, if we do calf raises, we're really going to strengthen those muscles in our feet and our calves to influence our balance. So what they found is our big toe is a big deal, that it can reduce fall risk significantly if we strengthen it. There was an Australian podiatrist that did research on it, and we can test the big toe for strength or weakness. And how we can do that is on the edge of this Toe Pro over on the right-hand side, you can see that you're just pushing down with that big toe against that. Isometric exercises are like exercises that you're doing and holding and pressing. Those are found to be harder exercises or more effective exercises because we're not just doing them quickly. It wouldn't be like doing a bicep curl really quickly. We want to do it nice and slowly, so it's more challenging. The big toe, if we do a press down and hold for a few seconds and then relax and press down and hold, you're going to make more strengthening. So the research found that the Toe Pro exercise, that one where they're coming up on their toes on the left-hand side, led to a 35% increase in toe strength in just 6 weeks. That's a significant gain. The toes on the outside, the 4 toes on the outside, have a less of an impact to our balance. Our big toe has a greater impact. If we strengthen our big toe by 1 pound, we're going to decrease our fall risk by 7%, which is pretty significant. The one thing that's a little hard is we don't have normative data yet on our big toe strength because no one has conducted the studies. However, we do know that how much we weigh ourselves personally, about 10% of that should be our strength of our big toe. So we can always make strengthening gains on our big toe and impact our balance. What they also found was it wasn't just our muscle strength. It wasn't our butt strength, our thigh strength, our calf strength that actually made us have better balance. It was more contributory of how we responded to that based on our toe strength. So those 4 toes and the big toe. So the toe strength is the single best predictor of a fall risk. Adults, like I said, produce 10% of their body weight in strength. And then the 1 pound strength decreased the risk. They did do a non-fall study, which is located on the Human Locomotion website and listed at the end, that there was a 20% strength difference. Like the people that had less fall risk had way stronger big toes in that study. So there was no difference in the muscle strength in the lower body. Here is another way to do toe strengthening exercises without the Toe Pro, because I think it's important that we make things low tech, and then we can always get devices that can improve our strengthening of areas as well. So the big toe strength, we can take a band and put it around the big toe, and what you're going to want to do is press down while your body is pulling up on the band to make it resistive. You can add a metronome to the background to again facilitate that brain and the balance center where muscle strength is coordinated to make it a better exercise for your brain. The other one is the 4 toes. So you're going to be pulling up on the band and then pushing downward with these toes down towards the mat. The other exercise listed here was listed from the Human Locomotion. So you would be standing and you would be coming forward to the point where you can stay stable. You would be supporting, your toes would be supporting you, and you want to keep your posture nice and straight, and then you would come back after about 5 seconds with that to an upright position. That's going to strengthen your toes as well. And again, is a low tech. We always want to be safe in our home or wherever we're doing therapy to make sure something is by you for safety purposes. The next part we're going to talk about is sensory. So we're going to go back to sensory. So the really cool part about sensory is the brain communicates together. And sensory, which is right here in a part of our brain, fires into the front part of the brain, which is our motor, where we plan movement, where we make movements. And so we use sensory modalities such as vibration, which I'll talk about. We use sometimes TENS units. We use sharp dull. We use deep touch. We use all forms of sensory to be able to give impact to that motor movement of our body, because that's where balance is really impacted real time, is to say, how do we make that connection better and better? So this therapy that I'm going to talk about first is called a stim pot therapy. It is a therapy that we can trace nerves throughout the body, so your feet or your hands. And I use this a lot of times for people that have poor balance for either neuropathy or for POTS, which is a condition that affects balance, or I might use it for just better communication to that area if they have an injury. And what it does is it sends a pulse signal. So some people get implants in their body for pain from their back down to their lower body. This sends a pulse frequency, so it's a little different, but it sends messages to those nerves, and then those nerves better communicate with the brain. So it's a way to send messages from the outside, from our periphery, up to our spinal cord, which has highways that communicate to our brain that then send those messages to that area. So it has a high impact. It's a different type of therapy that's out there that can impact balance. Vibration. Vibration is a really interesting thing that we can use very small technological things that you can buy from a store that just is a little massager. We can get things that are like devices like this. This is called the ResiMax. The ResiMax is a patented technology that has the same vibration as our vocal cords. So not all vibration is safe for us or is a desired type of vibration, because our body says, what is that? Like a jackhammer wouldn't be a vibration that we want to feel. But there are vibrations that our body likes and perceives as like, oh, I like that. I'm going to send that information on to the next place, which I was telling you is important because it's going to impact your balance. So the ResiMax, this device, I often strap to someone's leg on the side, or maybe both sides of them, to give more information to the brain while we're doing exercises, because sensory feeds into motor movements, which helps us move better, gives information to the brain. We also use power plates where I work, and power plates are vibrational devices that work in 3-directional planes. You can stand on them and exercise on them. You don't have to be able to do really big exercises because they activate the muscles for you and condense the workout time. They've been found to be helpful for balance, for muscles, for bone density. There's a lot of advantages for circulation using the devices. So I love them because people get a shorter workout and they also get better gains faster. Power plate also makes a peanut, which is a smaller version, and this vibrates. And you can you can roll it across an area. You could put it on the bottoms of your feet and roll it around. And this again fires into that part of the brain that talks to the motor part, which is really important for your balance. The next one is a box socks. They're an interesting technology that's out there for improvement of balance. So I had a specific patient that I saw in the past that I can tell you had a direct impact. Their inner ear was greatly impacted because she was a pilot and she had damage to her ear. And she didn't have any capability of knowing where her balance was. It was a really hard thing, structurally changed. So what happened was I had her try these socks because they have basically this patent technology like our thumbprint is. It has this microscopic information in both the inserts for shoes as well as in their socks. And I had her put these on, and I've had other patients use this technology as well for neuropathy. But this specific patient, she had a huge impact with having the technology on. She could balance, and not having it on, her balance was all over the place. So it gave her sensory information without having vibration on her or having something else that was more technology. And it gave her improved balance, which I think is pretty profound. With it just being a sock or an insert. We can use weighted blankets as well as a therapy for touch when it comes to sensory. So weighted blankets are really good. I recommend to people to purchase like a twin size one, and you can lay it just over areas you want to give more information. Because our brain has different parts of sensation perception, like if you get pricked with a needle or a little pin tip, or if you have a soft touch, or if you have something that's vibrating or something that's deeper, we have a sense of different type of touch all the time that we want to give the brain different kinds of information. All right, so we're going to talk about circulation. I told you from the nutritional side, circulation is very important for our body, because if we don't get circulation, we don't get perfusion to our brain, which is a motor. We don't get perfusion to our legs, which sometimes can cause, swelling and changes in our symptoms. And so we just want to make sure circulation is the best that we can make it. Exercise is one of the primary ways that we can improve circulation. What that also does for neuropathy from a pain standpoint is it dampens pain. So a lot of times people don't have pain during the day, but they have pain at night because people stop walking and moving. But if we're walking and moving, what we do is we actually give input to our small diameter fibers, which are pain fibers, with our large diameter fibers. So exercise actually is kind of like Band-Aids our pain. It diminishes our pain when we move. And so it's really helpful for circulation, but also pain management. Low-level light therapy is something that people interchange with all sorts of red light, infrared. There's lots of differences when you look up research for light therapy. A lot of it is referred to as photobiomodulation, which is way big of a term, but light therapy can improve circulation. Again, like I said, not one thing is a magical wand. And there are some people that say, I tried this, it didn't work for me. Sometimes layering different modalities together or therapies together and making things more unique is going to give you a greater outcome. Red light therapy or cold laser may be a different frequency or more powerful. The devices that come out there, they are not all created the same. So, you may have a response with one technology and not as much of a response with another technology. A lot of the home units that are created out there for light therapy are not as powerful as we would like them to be for impact to the body, but they may improve some of your circulation. Saunas can be used to help with the detoxification. Again, decreasing inflammation is going to give better communication to the body, because we're going to have an opportunity. If we have inflammation, it kind of just makes everything messy, and we can't get the best fuel and delivery everywhere. And the nutritional part is really important. I have seen patients that don't have good vascular support. We've seen that post-COVID. I've seen vascular changes in individuals with other conditions that we need to support. And so doing proper blood work is really important. One thing that is often missed in labs sometimes is anemia, and we have to have good fuel and delivery to the brain to make sure we're not missing that information. And lastly, we have topical applications. Topical applications are basically can be home remedied things that you can use to help with neuropathic pain or just improvement of the muscle recovery. And so there's a company called Prologel that I use in my practice that their product neutralizes nerves. And so nerves get angry, they get acidic. And so it alkalines the environment. They have a product that's specific for neuropathy that has been very effective for pain management. CBD creams, they can assist with neuropathic pain as well. And then essential oils. There are many on the market. I like to use these specific oils for pain management. Helichrysum, cypress, aroma touch, and deep blue are my favorites to use for nerve-based generated pain. I hope that you guys gained some little nuggets today. I just want to thank you for your attention and just let you know that our lives can be greatly impacted by the foods that we eat. It's a daily habit. It's a daily choice, no matter what age we are. And so many people say, I'm older, the change is not going to make a difference. I see the most profound changes with people that give it an opportunity of trial. And we have to invest in our health on a daily basis. It's just like paying rent, paying a mortgage. We have to do those little investments on a daily basis because our health is impacted by that. And I would encourage you to make some of those choices from some of the therapies that were recommended, or find someone close to you that might be able to offer you some different perspective of how can you impact your body and your brain.
Thank you so much, Dr. LeeAnn. It's been an amazing presentation. We have a lot of questions that have come through, so we'll take the next 15 or so minutes to kind of talk through some of those, if that's okay with you. Okay, so you talked a lot about exercises with respect to improving balance. Do you know of any exercises that might actually slow the progression of peripheral neuropathy, specifically from the feet to the legs? Because as you know, as the disease progresses, it slowly kind of comes up, right, from the extremities into the trunk. Are you familiar with any exercises that might help kind of mitigate that progression?
Yeah, so I think it's a little multifaceted when it comes to, like I said, there's not typically one thing that is specific, but I do think the more we can map the feet and the legs and information to the brain, to the body, and the feet to the brain, the better. With that, I mean, because we start to lose a little bit of communication when we have nerve that has some changes. And so the better we can enhance communication, the more we can maintain things at a level that is improved. So like the foot exercises, leg strengthening, just really being focal, and the maps in the feet are smaller. So the more information we can give, the better. And to use multiple things, sensory or that way to blink, you know, just things that we can layer.
What have you found that doesn't work? So obviously a lot of this presentation was try this, do that, think about this. Are there any kind of like, don't even bother trying this, I've tested and, you know, studies have shown that this is a waste of your time, which I'm sure actually encompasses everything else, but is there anything maybe specific that you can speak to that you know does not work for balance issues?
What does not work is a cookie cutter program that I have seen people go through neuropathy-based programs, and they get the same care, which I feel like everybody is very unique and everyone's need metabolically, like their labs might really need something nutritionally that's missing. So I would say there's not a therapy that particularly fails that I'm saying like, don't try this therapy or don't try this nutritionally. But I will tell you, you're not like everybody else. I mean, the disease, the process of change is similar, but we're still very unique. So we have to look at all those factors and say, what doesn't work is just picking one model.
Understood.
That makes sense. Like everybody gets laser, everybody gets this, everybody gets, it just doesn't. I see people after those programs, and it didn't always work because they didn't look at them deep dive.
And to your point, until there are cures that are found for peripheral neuropathy, it's just various treatments that may or may not work. So yes, it does make sense, which I know is not always the answer that everybody wants to hear, but it's worth noting. So we've had a dozen people ask this, if not more.
Yeah.
Where can I find someone like you? Right.
Yeah.
So how can people, our folks are throughout the country, let alone even the world.
Yep.
Where do we find educated people that are helpful for peripheral neuropathy or neurodegenerative conditions in your field of integrative medicine, kind of this holistic approach? Where do people start searching for you?
Yeah. So a good place to start would be chiropractic neurology. Carrick Institute has a search tool, and we have internationally trained doctors that were trained alike. It doesn't mean that we're all trained in functional medicine aspects, but a lot of us are, and we have a lot of similarities. So there's not this polarized difference of care. We're trained similar to work through cases and work through someone's information that way. So Carrick Institute would be the website that could be searched, and you can say locate a doctor, and wherever you're located, you can look within a mile radius of where you're trying to search for.
And are you guys prominent throughout, or is it kind of, are you guys few? Are you many?
So it's definitely a niche industry. Not everybody deep dives into the neuro because it's a hard field. It's a lot of information. It's not everyone's passion.
Yeah.
So we're more niche, but there are more people that are really entering the field. And internationally, we have more people that have, because our education has been in other countries. So, and now that we have education, we can teach all over. It doesn't need to be in person always, so we can reach more people to get into the field.
No, that's great. During this presentation, you mentioned, and you gave examples of specific apps, but is there a list of all the apps you reference? Are they all in your slide deck? Or maybe I missed a few of them that you had mentioned, but a lot of folks are kind of inquiring about some of that. Is there a way that?
Yeah, I would love, I'm going to make a short educational document on the home therapies after this program, and I can include those in there, and that way it's a wealth of information to reference, and you don't have to go back through the program to get that information.
Perfect. No, that would be great, Dr. LeeAnn. And what we can do at the Foundation for Peripheral Neuropathy is take that article, put it on our website, and then blast it in our newsletters, post it on our social media. So that'll be really helpful. So for everyone that's watching, stay tuned. We hope to have something to you guys over the course of the next few weeks or months.
Yeah.
Great. Could you talk a little bit about supplements that might help circulation?
Sure. Yeah, so I talked a little bit about vinpocetine being in products. There's berberine that can be impactful. We have a lot of things that are just influential in a multi-way. I feel like I talked a lot about the gut, but those are the two highest level ones I use, and I use endocalyx, and I use things that are called that are like physician grade. And so you can get supplements, some of the things that I refer to out there, but there's different quality in products. But vinpocetine and berberine are probably one of the biggest ones that I use for improvement in circulation within a product. It's not just that. Maybe by itself, berberine might be, but an anti-inflammatory can influence some of the circulation as well. But the endocalyx product, which is more grapeseed extract based, which oligomeric proanthocyanidins, big name, OPC, that's another thing that has a huge impact on circulatory aspects of vascular health. But anything that has grapeseed extract is going to have that huge influence. Resveratrol, which is like all the good stuff from wine without drinking 40 glasses.
Yeah.
It's like a condensed version, but resveratrol, super powerful for inflammation and regulation of our immune system, but circulation is a huge impact with that.
Well, that's very helpful. And just following up on your most recent answer when you had mentioned the Carrick Institute, I just want to make sure several people are asking how to spell Carrick. It's C-A-R-R-I-C-K. Is that correct?
I-C-K, correct. Yep.
Okay. C-A-R-R-I-C-K. I'm just repeating it again for folks that are feverishly taking notes and Googling as we speak. You had mentioned a lot of stuff about topicals. How do you know, right? The internet will always tell us this is a great topical and use this, right? Like buyer beware though. So how would you recommend advising our folks to know where do you find the best topicals, or similarly, how do you know if you're getting advertised and it's kind of, you know, snake oil, so to speak?
Yeah. So I'm a research-driven person, so I will look for, does it have any validity to it? Is it reproducible and reliable? When it comes to essential oils, that's what I look for in the product that I use, which the company I use is doTERRA. And again, I get no proprietary anything for, but it's they're reproducible, reliable. The clinical results I see are great. So that's what I look for in essential oil. The CBD, I look for something that has diverse species, meaning there's not just like one. And so that gives it more impact. And again, we have that in itself, that world is a whole nother topic that can just go really far because there's a whole education in that world. But that's what I look for there. And then the topical with the Prolo gel, I tried it, I used it, I see the effectiveness of it. I wouldn't recommend anything I haven't used personally, because in clinical outcomes, if I don't see the clinical outcomes, I'm moving on. But if I'm looking and I don't know, I wouldn't gravitate to a lot of things that are sponsored or marketed to, because a lot of times those, you know, they're spending a lot of money on marketing for a reason. It's not word of mouth. You know, if someone's like, this is the best topical I've used, I'm taking word of mouth from some of my patients too, of like, this impacted my rare autoimmune condition of my circulation or whatever it might be. And I take into consideration those factors too.
And I think you raise a really valid point as we close, in that all of this is kind of great educational information that we're sharing with our patients and healthcare providers and their care providers. But to ask your, you know, PCP, right? To ask your physician, hey, is this something that I should be looking into? Is this something that would help me? Because to your point from earlier, nothing is cookie cutter. And I think these conversations are really great ones to be having with everyone's individual doctors. So yes. Okay.
Yes, absolutely.
Well, Dr. LeeAnn, thank you so much. We unfortunately ran out of time. The questions that are coming in are still amazing, and I'm so sorry that we're not able to address all of those. But as referenced, we will have this recording up as well as the slide deck, the PowerPoint slides. So all of this will be housed on the Foundation for Peripheral Neuropathy's website. Obviously, you can reach out to us directly if you have any questions, and we do hope to be sharing kind of a supplemental article following this program in the near future that will push out through all of our communication channels. So yeah, lots of interest, and we thank everyone. We thank you, Dr. LeeAnn, for all of your expertise, and everyone for joining us today. Again, feel free to reach out to us directly if you have any other questions, and we hope you'll continue to support us so that we can keep these types of programs running. So thank you.
Thank you very much. Appreciate it.
Yes, have a great day, everyone. Thanks again.
Yes, you too.
Okay. Bye-bye.